Hello, this DVD is for carers of people with dementia. What we're trying to do is to give you some ideas of understanding the processes that people go through when they have dementia and some tools for coping with the different stages. The idea is that it's hard work and we want you to have that opportunity to do the best you can for your loved one. So we're going to go now to Leslie, who's got first-hand experience of caring for someone with dementia, and we'll take it from there.
Good morning, Leslie.
Good morning.
First of all, I'd really like to thank you so much for agreeing to make this video for us.
You're welcome.
It's going to be really helpful for carers generally.
For me, looking back, it was just like stepping into another life from the one I'd had, because my beloved husband was changing before my eyes, and he was becoming a person that I didn't know anymore. Where would our path that we were on lead us to?
When I was training, there was only one type of dementia, and that was called senile dementia. And what I was taught was that people started with symptoms and they went through a process of deterioration and died within 2 years. That's quite a long time ago, but clearly since then we've identified more types of dementia and more ways of working, more understanding. And with neuroscience and brain imaging, we've got more ideas of what's actually happening in the brain.
Caring for someone with any form of dementia is difficult, painful, and a life-changing experience. In this film, we'd like to share with you some of the ways in which the caring role, whether in your own home with your loved one or after they've entered another form of caring environment, can be helped to feel more productive and thereby less burdensome for you and the person you love. The various stages are not necessarily in the order presented here, but most people will experience those on the left side in some fashion during the first 6 to 12 months following a diagnosis. However, the items on the right side represent regeneration and renewal, which we will begin to be able to see beyond our grief and loss and are able to begin to plan for a different life.
So to begin, if you just get yourself comfortable in a chair, make sure that your back is supported and that your feet are comfy on the ground in front of you. You could perhaps put your hands gently on your lap. And now you can turn your attention to your shoulders. Again, notice how they feel. Spend a moment allowing the tension to drift away. And now we move to our ankles and our feet. You may want to give them a little stretch to help the tension on their way, or allow all the tension and stress to go as you breathe gently.
When she was diagnosed with this vascular dementia, they took her onto another ward, and she didn't seem to have a lot of control over herself.
This time we were, to an extent, in denial, because we still had it in our minds that she was going to improve. Getting cross and finding things, antagonism all comes. You don't generate it, it happens.
Yes.
And then you sit down in the evening, you're not just cross because of the antagonism, you're even more pressured because you know you understand why it's happening and you shouldn't have let it happen.
Just so you may find
expressed.
that you feel guilty, perhaps feeling not good enough or not up to the task. You will at times feel angry, like, if he or she asks me that once more, I'll scream. Frustration and not being responded to in the ways you're used to brings resentment at not having time for yourself and being constantly at the beck and call of someone else. It's important not to allow yourself to become socially withdrawn. Being amongst others is a vital survival tool. By being alert, we can also learn to be excellent communicators, more in tune, and so we can learn to see more than is immediately obvious. We call this building rapport, a strengthening of the relationship that engenders warmth, trust, and a sense of safety. As your loved one begins to disappear before your very eyes, as Leslie said, Using these skills will become increasingly challenging and difficult. Decisions will need to be made. And the present reality will have to be confronted. You will not have to do this alone. But it's really important that you do not see these changes as being in any way a failure on your part. It's simply the progression of the disease.
What we've tried to do here is to make dementia less scary. It's painful to watch our loved ones disappearing, to see them going through those processes of dementia where we know that there is only one of the things that we've looked at are some coping skills, some ways of working that can be helpful, and we've listened to some carers so that they've been able to talk about what they have experienced, and we hope that's been helpful. What we do know is that the more confident you are as a carer, the safer your loved one will feel, and that's really important. We hope it's been helpful. We'd really be happy to have feedback from you, and anything that we can do to either improve this DVD or to help you with services, understanding, assessments, please get in touch. Thank you.